Good morning, everybody. I'm Delano Adamson, and this is Julius Smalley. We'll be doing artificial insemination, and specifically, we'll be focusing on post-cervical insemination in swine, transcervical AI, and also laparoscopic artificial insemination.
So we begin first by defining what artificial insemination is, and it's a technique in which semen with living sperm is collected from the male and introduced into the female reproductive tract using correct instruments and artificial methods. We first start by giving a brief background of what the history of AI is from its development all the way back in 1678, where with the discovery of semen and sperm, all the way up to the modern changes that have led to the refinement in sperm handling and processing. And we give a quick timeline of what that looks like from the picture of the first sperm cells all the way up to the first IV birth. And all these changes are highlighted in a nice diagram to the left of your screen.
Yes, so we'll first begin with laparoscopic artificial insemination. So this technique was first introduced in South Africa in 1985 by the scientist J.J. Stein. And this technique is predominantly done in small ruminants. Why, you may ask? So small ruminants, they are known to have interpleating cervix, which makes it difficult to practice traditional AI methods on them. This is a minimally invasive procedure, and it sees two trocars, two an instrument like two trocars being inserted inside the animal in order to see internally and maneuver your way into the uterus. So all right, I'll give a brief overview of this procedure. So for one, animal selection is the most important thing in laparoscopic artificial insemination. The animal selected should be of a good body conditioning score. They shouldn't be overly fat or they shouldn't be overly malnourished either. This is because it poses issues in the surgery or in the procedure. Two, the animals chosen they should be starved of food and water for 24 hours so that there is no surgical complication when the procedure is being done. Three, animals selected animals selected after the animals are selected, they are shorn. After they are shorn, the area is disinfected. After the area is disinfected, the trocars are then inserted. After the trocars are inserted, carbon dioxide is pumped into the abdomen of the animal. So this CO2 is the purpose of the CO2 is to provide space between the organs inside the abdomen and the trocars because this prevents the likelihood of damaging the organs. So after the trocars have been inserted, then you have the laparoscope that goes in next. The laparoscope allows the technician to see the inside of the animal and is able to maneuver until they get to the uterus, which is where they will insert through the uterine walls and then sperms is deposited right there. So laparoscopic AI it is very advantageous because it gets really good results with frozen semen. Also, more use can be done per ram per day, and this procedure is highly efficient, over 70% conception rate with this procedure. However, this procedure also has a lot of disadvantages. So one including that it requires very skilled professionals, usually a highly trained veterinarian or a highly trained technician to do this procedure. Two, there can be many complications that results from the puncturing of the abdomen wall or the lower abdomen walls. This includes you can damage a full bladder or a full rumen or any other organs inside the animal. Three, it's a very expensive procedure. The equipments are very expensive. The laparoscope, the trocars, all expensive. and plus some technicians utilize um, using sedatives like xylazine or whatever, which is kind of expensive as well. And also, the least, the least, not the least, if the technician there's a mishap, this can lead to the death of the animal and it can lead to extensive damages inside the animal. So it's a very finicky procedure and it requires really good care and good management practices.
Alright. So the other technique that we're going to talk about is transcervical artificial insemination. And this is what most would refer to as traditional insemination. And it was pioneered in 1990 in Canada by Campbell and his counterparts. And it is primarily done in sheep, domestic dogs, cats, and smaller animals due to its low cost. And so most of this is at your local vet, you probably experience this. It involves the passage of a catheter through the cervix into the uterine lumen so that the semen can be deposited directly into the uterus, and that way increases the chances of fertilization. This can be done unguided through palpation, such as in cattle, and it can also be done guided by use of an endoscope that is inserted at the same time as the catheter. TCAI is done at any age so long as the animal has reached sexual maturity. It does not matter whether this is their first pregnancy or this is their second time, and that makes it ideal for using on large herds if you want uniformity and anything else that would hinder you otherwise. The major advantage is that transcervical artificial insemination has very high success rates, an average of 70% trans species, but in certain species, this can go all the way up to 85%. There's minimal risk to the reproductive tract of the animal. This makes it very ideal if you're working on a large group and you're afraid of some of the repercussions. It also works well for frozen semen, which makes it very conducive for people that are trying to improve their herd genetics with outside semen. The main disadvantage is that there's increased risk of intrauterine infections because if you're introducing external variables directly into the uterus of the animal. And the second is that it requires specialized use, especially if you're using guided transcervical artificial insemination, as you will require the use of an endoscope.
And now we will touch on post-cervical artificial insemination in the sow. So what is post-cervical artificial insemination? This is insemination whereby semen is deposited beyond the cervix and directly into the uterine body of the animal. This is done in a variety of animals, but it's mostly done in sows or in pig production. So this this method was developed back in 1959 and was first described by the scientist J.J. Hancock. So how is it done? It is done by first introducing a catheter through the vulva, through the vagina, and you guide it through the cervix of the animal. After that, there is an insemination tube inside this catheter. So the insemination tube is guided through the catheter and into the uterine body, and that's where you deposit the semen. Also, PCI is usually performed in sows that are farrowed at least once, and the sow must be in estrus and in the presence of a spotter bore. It's important. I apologize for that. So the bore should be present at estrus or estrus detection, but the bore is not needed at time of insemination. So let's go into the advantages and the disadvantages of post-cervical artificial insemination. So the main advantage is that it is relatively cheap. the equipment or the instruments used, they're cheap to use. They're cheap to get. The dose required for successful insemination is lower, and this saves a lot on the production. Also, this increases the uniformity of the drove of animals there. Some of the disadvantages of PCAI includes that it cannot be performed consistently in younger females. This is due to the fact that the cervix has not been completely relaxed as yet, and it is not completely developed as yet. So it is definitely harder to inseminate the younger females with this method. And also, with any method, there's an increased risk for intrauterine infections. And below that, you can see a diagram that depicts what post-cervical insemination looks like in the cell.
Right. And so we see a lot of benefits coming out of AI with the reduction of cost and risk that came with the maintaining of bulls and boars on the farm operation, which has served a lot of people. And this has also reduced the number of venereal diseases because they would spread pretty quickly within a population, especially where those one or two males. It has also extended the useful life of animals, especially sires. So you get boars and bulls that can be bred for longer and thereby having an extended life as where they'd be called otherwise. And you see a massive increase in conception rates, with conception rates north of 80% in most of these techniques. And it also makes breeding of animals of different sizes possible without injury, which is very critical in some operations because you do want successful breeding, but you do not want the risk of hurting the animals.
And some of the overall disadvantages of artificial insemination includes that it usually requires some specialized skills or knowledge of the reproductive system or reproductive tract of the animal in order for it to be successful. So without the knowledge, the chances or success rate would be minimized. Also, the improper cleaning and maintenance of instruments can result in infection, which can pose additional costs to maintain. Also, if semen is not properly tested or properly analyzed, then the spreading of genital diseases will be increased.
So we see a table just to see the reductions and benefits that AI has with the reduction in volume of sperm needed and the success rate and the time required for breeding. We also see a chart of the adoption rate based on different industries with 95% in dairy cattle, 5% in beef cattle, and all the way up to 100% in commercial take. And so, from a biblical point of view, we need to recognize that God is sovereign over everything, and AI it does fall under that. And therefore, we as Christians need to be part of AI, whether it is practicing it or redeeming it when people abuse it. In Genesis, God tells his creation to be fruitful and multiply, and AI is a means of achieving that. Whether it's treating infertility or increasing fertility, as we've seen in most of these cases. And therefore, it is a godly thing to do. And as stewards of creation, we have the responsibility to take care of creation. And this takes the form of treating infertility or improving the quality of the animals so that they can enjoy a better life, which we do through genetics, and that's mostly done by the help of AI. And we just see some of the reminders in the Bible of the authority that God has given us over creation and the responsibility that comes with that, which is why the final point that we should take is that everything we do should not be for profit or for gain alone. That is important, but we should also do it because it helps creation and we are responsible for it.
Yes, and if you guys have any questions, you can ask away. Thank you.